You're listening to Your Best Life, powered by MercyOne. Join us as we have a fun conversation with certified experts and physicians about health topics for you and your family. It's Your Best Life, our one purpose.
All right, so Dr. Mayin Lin is joining us today. Dr. Lin is a colorectal surgeon at MercyOne Des Moines Surgical Care. Hi, Dr. Lin.
Hi, Liz. Thank you for having me here today.
Thank you for joining us today. Can you just kind of tell us a little bit about what you do as a colorectal surgeon?
Yes, as a colon and rectal surgeon, we treat diseases of mainly the colon, the rectum, and the anus. Many times, too, depending on the disease process, we also treat diseases of the small bowel.
So we're going to talk today about debunking some colonoscopy myths. Do you feel like most patients come in kind of with an understanding of how things are going to go, or do you see a lot of apprehension in people?
Yes, definitely. I think colonoscopies are somewhat stigmatized out there. There are a lot of myths about getting a screening colonoscopy. And one of the most popular ones I hear is that it's a really difficult procedure to undergo. People think it's painful and it's very awful. But actually, colonoscopy procedure is not painful. And typically sedation is used very generously during the procedure to minimize any discomfort that people may have. Actually, most of the time, people wake up from the procedure afterwards and they ask me, did we even have the procedure? So, I think that's one of the things most people have a misconception of.
One of the myths that we found was a lot of people think that if they don't have symptoms that they don't need to get a colonoscopy. Can you talk a little on that?
Yep, absolutely. So definitely something that I hear very often is, well, screening is only necessary for individuals who have symptoms. But actually, the reality is that since early colorectal cancer usually has no symptoms, that's what makes getting screening colonoscopies even more important. Colonoscopies are designed when we do them for screening to catch polyps and things that will eventually develop into cancer. But the whole thought behind doing screening is that we catch them early before it becomes cancer. And so screening is actually to check for cancer in people with no symptoms at all. And right now, the recommended age for getting your screening colonoscopy for people with no prior personal or family history of colon cancer is 45 years, because we've seen a lot more of colorectal cancer in younger and younger patients as the years go on.
Yeah, I was about to ask. I believe that it was older previously, and they actually recently, within the last few years, lowered that age down to 45.
Yes, you're absolutely right. It used to be 50 years old, but recently, if you look at the trends from an epidemiology standpoint of patients in the U.S. Getting diagnosed with colon and rectal cancer, it's the age group has dropped quite a bit to younger folks, and that's what led to the change in the guidelines recently.
One of the other myths that I saw a lot of was, people were saying I don't have symptoms, but the other thing was I'm not at risk, so there's not family history, so I also don't need to have a colonoscopy because of that.
Great point. So yes, that's what a lot of people think, that only people with a family history of colon cancer can get it. But in reality, about 75% of all new cases of colorectal cancer actually occur in patients who have no known risk factors for the disease and no prior family history. In fact, in patients who actually do have a family history, we usually start many times even earlier than the recommended 45 years, depending on when the youngest age of someone who had it in their family was. So that's definitely really important for people to know. Even without a family history of colon cancer, it's something important still.
I'll also ask, I know a lot of people think, well, because I'm a woman, and colon cancer is usually talked about, when we're talking about men, but women are also can get colon cancer. So can you talk a little bit about that?
Yes. So colorectal cancer can strike both women and men. And actually, in the recent years, we estimated about 78,000 new cases of colorectal cancer diagnosed in men, 69,000 of those diagnosed in women. And actually, colorectal cancer is the second leading cause of cancer death in both men and women in the United States. And so, actually, slightly more than half of the people who actually die from cancer are actually women. And so, um, you know, whichever way you look at it, it can equally affect both men and women. It's equally as important for both men and women to get their screening colonoscopies.
Okay, so I'm going to move a little into talking about preparing for the colonoscopy and the actual myths around the colonoscopy themselves. So a lot of people, I think, in just conversation and have fears that the prep, the days and before, is like incredibly horrible to go through, that there's a lot that they have to do to prepare for a colonoscopy. What does the prep look like now? Because I know it's changed.
Yes. So one thing that many people, and I think this is just passed on from, previous generations when they're telling their kids about their colonoscopy experiences, they would say, oh, I had to drink 4 gallons of stuff and it was awful. And it was just so much liquid. I felt like my teeth were floating in my head, that sort of thing. But we have a lot better and lower volume preps now. You know, in all honesty, it's not going to taste like, a nice cold beer or, soda or anything like that. It definitely, it's still prep, but it's much lower volume now and it is much more tolerable. And more and more, I feel like I don't really hear people tell me the prep was that awful. And so I think we have a lot more tolerable and more palatable preps now.
Yeah. So for people who don't know, like what is the prep, that like what does it all consist of? What is the purpose of it?
Yes, definitely. So one of the most popular preps that we've been using is a combination of Miralax and Gatorade, actually. So we'll have our patients go purchase some Gatorade, and then we'll send in for the Miralax. And, if you think about it, it's the same Miralax that people get over the counter that you might take occasionally for some constipation here and there. And so it's just more volume of that. And so you just mix it in with the Gatorade, tastes like Gatorade. And the purpose of the prep is to clean out the colon of any stool. The point of a colonoscopy is so we can see the colonic mucosa and the inside of the colon. And in order to do that, it's important that we clean it out so that there aren't a lot of stool residual particles that are there covering the mucosa. And that way we can get a really good look at everything.
So I know we kind of talked a little bit just right off the bat about the colonoscopies being painful, but some people also are afraid that colonoscopies are dangerous. Can you explain that?
Yes, so that is a great point. As with any procedure or any surgery, and I'm a surgeon, so I definitely talk to my patients about any type of risk before starting the procedure. There's always a risk of bad things happening. And, I would say similar to you getting in your car in the morning and driving to work, there's always a risk that an accident can happen. Sometimes it's not really within your control. What I can say is the risk of injury to your colon actually happens at a very, very low rate. And, even when it does happen, we recognize those things immediately most of the time, and we're able to take care of you and take care of the problem. So I think that the rate of injury to the colon is probably exaggerated a little bit. Out in conversation and things like that. Obviously, if you have a friend who's had a bad experience with it, it's going to affect how you feel about it. But when you look at all the colonoscopies being done every day in the entire US, these complications actually happen at a very, very low rate.
One of the other things that I feel like definitely comes up in conversations around colonoscopies is people are a little embarrassed, or they feel uncomfortable, especially talking about that. Can you kind of just walk us through why they shouldn't?
Yes, I can understand that. I'm coming up on my own colonoscopy here in a few years, and it is a little embarrassing. It's an area where the sun doesn't shine, and it's not really on public display all the time. So, um, most people though they don't remember very much from the procedure at all, and when you go into the procedure room you're completely covered up. We don't typically start the procedure until you've gotten a few rounds of the sleepy medication and you're very comfortable, and it's at that time where we start the procedure. So really nothing to feel embarrassed about. Everyone has a colon, and everyone needs to get it screened. So nothing that we haven't seen before.
Yeah, I was about to say, safest place to be with are people who do this for a living. You know what you're doing.
Exactly. That's why we went into colorectal surgery.
Right, exactly. Awesome. Well, next month or March is Colorectal Cancer Awareness Month. So is there anything you want to talk about there?
Yes. So, just starting off briefly, colorectal cancer, it's a cancer of the colon and rectum, and it all begins with development of precancerous polyps that occur in the lining of the colon and rectum. And a lot of people ask me what polyps are. They basically are mushroom-like growths. They form when cells lining the colon grow, divide, and then eventually reproduce into unhealthy type of cells. And polyps can become cancerous over time. They invade the colon, and eventually, if not taken care of, they can spread to other parts of the body through the blood vessels. And so, because men and women are equally at risk for developing colorectal cancer, even if you don't have a family history. Screening colonoscopy is really the most powerful tool we have to prevent cancer. And I think that's one thing I wanted to hit home is that colonoscopies, the goal is not to detect a cancer, especially in patients who don't have symptoms. It's really to prevent a cancer from happening. And if we're doing our job and getting the message out there with screening colonoscopies, we should be able to lower the rate of people getting diagnosed and dying from cancer every year.
Yeah, absolutely. I know that's always the big push with all cancer screenings is cancer screenings are preventative. They're not that that's their whole purpose is to prevent cancer from forming. And then if it is caught, then it's caught at a early stage so that it can be eradicated quickly.
Exactly. And, Liz, I think the last kind of important point with regards to colorectal cancer screening is that I think a lot of people, have heard about a blood test or a stool test that can be sent in to detect cancer. And I think it's important for people listening to this podcast to know that the colonoscopy is still the best tool that we have. It's the gold standard. And the beauty of it is that it's both diagnostic and therapeutic. And what I mean by that is if you send a sample of your stool in or a sample of your blood in to get tested, if that detects an abnormality, there's no option at that moment to treat it. But when we do a colonoscopy and we find a polyp, we can and we do treat it at that time by removing it. And so you can think of a colonoscopy as a one and done, whereas if you opt for the blood or the stool test, you have to come back for a colonoscopy anyway if it's abnormal. So, I think that's important for people to know.
Yeah, absolutely. I mean, and if something is found and like you said, you have to come back in for a colonoscopy anyways, you might as well get it done with the first time.
Exactly.
Awesome. Well, thank you so much for talking with us, Dr. Lin. Is there anything else you wanted to let the people know?
No, I think that was about it, with regards to everything we've talked about so far. Colonoscopy, just to conclude, it's really not that scary. And it's really worth taking the time to take the prep and go through the procedure. It's a same-day procedure, so you can get out of there in a couple hours, continue on with your day, and the payoff is immeasurable if we take out polyps that could potentially turn into cancer later on.
Yes, so true. Awesome. Thanks for listening. Send us feedback by emailing podcast@mercyhealth.com and visit us online at mercyone.org/podcast for all of our episodes.